Allergy season is in full swing, and many of us are feeling the effects. Here to talk more about allergies is Doctor Meagan Moore, a naturopathic physician and a member of the Arizona Naturopathic Medical Association. Doctor, thank you so much for being with us.
Thank you for having me.
First off, we're experiencing, some warmer temperatures across the country. Does this mean that allergy season is getting longer?
Yes, to a degree. The reason why seasonal allergies increase every season is due to the various plants and trees that are constantly blooming during springtime. And, the longer the season is drier the air, the faster the wind that's blowing, the longer that this dust and pollen can kind of blow around in the air we breathe and can contribute to the development of different seasonal allergy symptoms. So the longer and the hotter and the drier the air, the longer the allergy symptoms can totally stick around.
Okay, so how do you know when it's seasonal allergies causing your issues and say, not COVID? What are the symptoms? What's the difference?
Yeah, so a lot of us are familiar with the reoccurring symptoms of allergies, such as sinus pressure, postnasal drip, itchy, watery eyes, or even itchy ears, etc. Common symptoms of seasonal allergies can look very similar to symptoms of coronavirus, in particular cough, sore throat, and nasal congestion, and even elevated temperature, to be quite honest. And the most reliable way to determine if you are infected with COVID is, of course, to get tested. So it's very important for people to be vigilant with monitoring their symptoms. And with this current pandemic situation, always take precautions to minimize COVID-19 spread.
Now, doctor, anything we can do, any tips to keep allergies at bay? What can we do?
Right. So mainly, the main thing that we can all do is just kind of reduce the exposure to allergens as much as you can, and kind of help control that histamine response that leads to the allergy symptoms like hay fever and the severe symptoms we always have. So one way to do that in particular is to reduce the allergens that you are exposed to in your home. So such as removing carpet, using allergen-reducing beds and pillow coverings, even keeping your windows closed during windy days. So it's all about just minimizing that exposure to the allergens that cause your symptoms, which can be difficult, but it's also possible.
Now, what about medication? First off, do you recommend it? And if so, is it something that you have to use on a daily basis?
So every patient is different, every set of seasonal allergies is different, and every treatment should be very individualized depending on the symptoms you have experienced and what your health status is. And in particular, various over-the-counter medications are good at keeping different intense seasonal allergies under control. But oftentimes, they do require daily utilization of those medications to prevent flares of allergies, as well as keep them under control throughout allergy season, which is fine. I mean, that's good if you want to, keep your symptoms under control. However, a lot of those over-the-counter medications do have side effects that you have to discuss with your healthcare professional and that you have to monitor for, such as high blood pressure, drowsiness, fatigue, different things like that. So always monitor with whatever medication and treatment you're doing, always monitor for any changes that you experience and any additional concerns that you need to discuss with your doctor or your healthcare professional.
No, doctor, you are a naturopathic physician. So any tips on natural remedies?
Yeah. So, like always consult your individual naturopathic physician, because again, everyone is different. Everybody's got different symptoms. But to be quite honest, the care that you give, like the natural remedies that you utilize, should basically target the symptoms that you have. So, for example, congestion. I really love doing steam inhalations with eucalyptus oil and lavender essential oil. That is really good for kind of clearing out that congestion and kind of calming down that swelling in your sinuses. Sore throat. So saltwater gargles are actually the age-old treatments for general sore throats. Even stinging nettle tea with local honey sweetener inside, because the honey is made from the local bees that actually consume the local pollen and help kind of give us that antigen exposure so we can kind of create that immune response against the pollen that's specific to your area. Basically, great herbs that are great for modulating histaminic responses, such as stinging nettle, are really good. My favorite vitamins and minerals that I like to use for allergies include like vitamin C, N-acetylcysteine, quercetin, and even bromelain. All of which are really strong antioxidant molecules that bring down inflammation in the sinuses and help combat the histaminic response that leads to all of the troublesome symptoms. Another common thing that a lot of naturopathic physicians recommend are also probiotics. So the whole point of establishing a good, healthy microbiome is to help contribute to a healthy immune response and healthy immune system. So any kind of help that you can give to the gut is always going to be beneficial to you.
Gosh, so many good tips there. Now, any final tips, any final advice, doctor, on ways we can get through this allergy season?
Yes, take care of yourself. We live in an age where we tend to kind of put ourselves on the back burner and basically try and just get through the symptoms that we're experiencing. But the longer those symptoms stay around, the worse they can become and the more susceptible you can to other things like infection or even sinus infection. So always do your best to monitor your symptoms and adopt vigilant and healthy practices that can help reduce the inflammatory response as well as help resolve your symptoms and get to the root cause of what's causing everything. So always take care of yourself, even not in allergy season.
Doctor, so many great tips. Thank you so much for your time and for joining us. If you'd like more information, head over to the association's website.